The case that I'm talking about today was a low rectal vaginal fistula, which is very common and most commonly occurs after child delivery, inflammatory conditions, surgical trauma to the anal-vaginal area.
Shortly after the birth of my twins, I noticed that I had a problem with some rectal discharge vaginally. So I went to my OB/GYN and she examined me and she said yes, that it did look like I had something, what she called a buttonhole that had probably been created during the birth of my second child. And that tear causes like a tube to form between the vagina and the rectum, and that's why there is some passage of stool that starts coming out through the vaginal canal.
Donna's case was just a very simple, low rectal vaginal fistula. She was passing a little bit of stool, so I chose the endorectal flap repair, which is minimally invasive and requires very little hospital stay. Inside the rectum, we create a small sort of trapezoid-shaped flap consisting of the lining and a little bit of the underlying musculature. We then close the area underneath, then bring the flap back down and sew the flap in place.
My main concern about having surgery with 4 small children was I didn't want to be gone long from home. I didn't want to have an overnight stay if I didn't have to. And so that was very attractive to me. And also he said that this would not be a very painful procedure, which it was not.
I think that most patients that have this condition, once it's fixed, are very happy with the results.
Glad I didn't wait until the symptoms were so bad that it was going to be a much more involved surgery.